Hello everybody, my name is Christy, and the topic that I'll be presenting today has a lot of meaning to me, and that topic is mild neurocognitive disorder due to brain injury. I myself experienced a traumatic brain injury several years ago when I was hit in a motor vehicle accident and ended up having brain surgery and all sorts of fun side effects like that. So I was eager to be able to present on this topic and to learn a little bit more about it myself. So let's get started. A mild traumatic brain injury. This disorder is the byproduct of a forceful impact to or sudden movement, displacement of the brain within the skull. Mild TBIs have a wide range of physical, cognitive, and psychological effects that may appear immediately following the traumatic event, or they may not appear until days, weeks, or even months later. So we can start with the diagnostic criteria for mild neurocognitive disorder according to the DSM-5. A. Evidence of modest cognitive decline from a previous level of performance in one or more cognitive domains, and this is based on concern of the individual, a knowledgeable informant or the clinician that there has been a mild decline in cognitive function, as well as a modest impairment in cognitive performance, preferably documented by standardized neuropsychological testing, or, in its absence, another qualified clinical assessment. B. The cognitive deficits do not interfere with capacity for independence in everyday activities, like paying bills or medication management, but greater effort, compensatory strategies, or accommodations may be required. C. The cognitive deficits do not occur exclusively in the context of delirium. D. The cognitive deficits are not better explained by another mental disorder, such as major depressive disorder or schizophrenia. So moving on to major or mild neurocognitive disorder due to traumatic brain injury. The DSM-5 criteria for this are A. The criteria are met for major or mild neurocognitive disorder, which we just reviewed. B. There is evidence of a traumatic brain injury, and according to the DSM-5, the definition of that is an impact to the head or other mechanisms of rapid movement or displacement of the brain within the skull with one or more of the following: loss of consciousness, post-traumatic amnesia, disorientation or confusion, neurological signs, some of which could be neuroimaging demonstrating injury, a new onset of seizures, marked worsening of a seizure disorder, visual field cuts, anosmia or hemiparesis. And C. The neurocognitive disorder presents immediately after the occurrence of the traumatic brain injury or immediately after recovery from consciousness and persists past the post-injury period. So the article that I chose to explore for this topic is Understanding Brain Injury in Females, a State-of-the-Art Summary and Future Directions. So in my personal life, when I was researching brain injuries and recovery and all that, I was so underwhelmed at the amount of information that there is regarding females and brain injuries. Most of it was focused on men and sports injuries and things like that. So the data was skewed well towards our male counterparts. So these are just a few touch points from the article that I read. This article highlights the significantly disproportionate way that women are underrepresented in clinical trials and research studies involving TBIs. The article also illuminates the sex-based differences that increase the susceptibility and hinder the recovery process in females with a TBI. These sex-based differences include the difference in cranial structure between men and women, the difference in cerebral blood flow between men and women, the impacts of progesterone, and neuroinflammatory responses. Additionally, the article emphasizes the importance of including sex as a biologic variable when designing and implementing future studies. So thank you for taking the time to listen to my presentation, and have a great day.